in the absence of enough vaccines, governments are creating medicine kits. And there's a huge amount of debate over the medicines we're administering. I know you've spent some energy urging state governments not to use ivermectin. You've even shared the press release of the manufacturer's Merck to say it's the wrong medicine. But we continue to actually see now it being included in part of what could be rural India's templated medical kit response. We have seen similar debates around Remdesivir, around Azithromycin. So I just want you to walk us through some of the bad science, some would say, that is being applied in a panic situation in India one by one. So let's start with the ivermectin.
Evidence-based guidance and treatment prevention is really the way to go. And what we've tried to do at the WHO is to update our guidance as often as possible based on the emerging data. So we have something called the living guidelines that we update, whenever some new evidence comes out. So we've got guidance on, hydroxychloroquine, lopinavir, ritonavir, interferon, ivermectin, remdesivir, and all of these, the evidence does not support its use, on a wide scale for people infected with SARS-CoV-2. The one drug that has a big mortality benefit is simple dexamethasone, cortico-steroids, given at the right stage of the disease, because COVID-19 is a viral infection. As of now, we have no antivirals that really act very dramatically on this virus, and they would need to be given in the early stage of the disease. We're hoping that there are some antivirals in development that will come very soon. So in the early stage, you can use monoclonal antibodies, again, still under research, antivirals. In the second phase of the disease, that's the anti-inflammatories which act, because that's where the lungs are getting blocked with inflammation and people's oxygen levels are dropping. That's when steroids help. And anti-inflammatory drugs, the anti-IL-6 inhibitors, they help. That's when patients need oxygen. So what's life-saving? It's oxygen, it's corticosteroids given to moderate and severely ill patients, and perhaps the anti-IL-6 inhibitors. None of these other drugs that's widely being used, including antibiotics, has any role.
And the azithromycin and the ivermectin and the FabiFlus that are now being given as set-based templates, you would say none of these need to be given or should be given?
There's no evidence that they have any impact on the disease progression. So I would rather spend those resources on giving people good quality masks to wear. In the absence of vaccines, masks are the only vaccine. If everybody wears good quality masks, properly covering their nose and mouth, that is going to make a big difference at the community level. And then, of course, spend resources on ramping up oxygen and other supplies that you need in the hospital, getting the workforce there ready. You will have to supplement the workforce because the existing doctors and nurses are not going to be enough, to cope with the kind of load that we've seen. So those are the kind of investments that need to be made. And, these drugs really, that's not going to be the ones that have an impact.
Okay, I know you're on limited time. I just have one more question on the drugs and then we'll do the overall picture. Remdesivir and plasma therapy. These are two, again, obsessive things that continue in India. Your last word on those.
Again, we don't have WHO guidance on plasma therapy, but a large trial which is just reported, the recovery trial, in a very large number of patients showed clearly that plasma therapy is of no benefit. The ICMR trial many months ago showed the same thing in India. So plasma therapy, again, there's poor patients running around, trying to get plasma for their relatives. I can understand the desperation, both on the side of patients and on the side of doctors, to just do something, do everything possible, to save your loved ones. But unfortunately, using these unproven therapies doesn't help, to save lives. So what's really critical is oxygen at the right time. So monitoring of people, making sure they get oxygen when they start desaturating, they get the corticosteroids at the right time, they get, ICU care and ventilation, supportive care at the right time. That's really important. And I think ongoing research. So again, India has a large number of scientific institutions. There are a number of early leads that different labs are talking about. All of those need to go through clinical trials and should be tested to see whether they have. We desperately need better treatments for this virus. We don't have. And so that should continue. But in the meantime, it is really the approach of testing, identifying people, following them up, monitoring them, getting them into care. The majority of people will not need to be in hospital, obviously. They can be managed at home. But the ones who need to must get there. And that's the only way to reduce the deaths that we're seeing happening now.